Thanks, team. Well, tonight is all about the men, and we're talking about male breast reduction, scar revision, and a procedure that went wrong that Dr. Dunkley has had to fix. Take a look at tonight's clip.
My name is Jason, and I'm 39 years old, and I am having a male tummy tuck and a scar revision and a male breast reduction.
His incisions before had been closed in probably too few layers, and so he developed an indentation under that scar.
When I had done that first surgery, I had noticed that that looked great, but then everything else looked off. So I ended up having flank surgery, and eventually basically was cut all the way around to reduce the appearance of the flanks.
Dr. Dunkley, how are you?
I'm very well.
All right, so part of the procedure that people are going to be seeing tonight on the episode is a scar revision. Now, Jason had a previous tummy tuck with someone else, didn't he?
Yes, he did.
Talk me through this a little bit with what he's had done.
So he had a tummy tuck and later was unhappy with how the backside looked, so then had the bottom lifted as well. So he has an incision that goes all the way around.
Is a procedure like this, a tummy tuck on a man, similar to the way you would perform it on a woman?
It is very similar. We
Okay.
do put the scars in slightly lower locations sometimes so as not to give them so much of an hourglass shape as we would with a woman.
Oh, okay. Well, that makes sense.
Yes.
Jason's scarring was a little all over the shop.
It's a little
Isn't it?
irregular, and he
Yeah.
did have one of his incisions pull apart, and it's left kind of an indented area.
How do you fix that?
We need to get the old scar cut out and then close it again, and with better layers. We need some good fat layers underneath so that there's some support right under the incision and we don't get it collapsing and forming an indent.
Okay, I think this is an important question because people out there that have had surgeries gone wrong, okay, how soon can they come back and have something redone with you if it's been done badly by someone else? How long would you wait for something?
I usually want a patient to be at least 6 months out from their surgery.
Right.
We'll see changes up to 4 months after a surgery, and I want them to be completely healed. I want to know what it's going to look like before I try and improve it.
Okay.
And change it.
One thing I laughed about when Jason was doing his interviews is when he said to me he's having a male breast reduction, and it's not because he had breasts like Dolly Parton. Okay?
No.
Explain what a male breast reduction is, just so people can understand.
A male breast reduction involves moving some of the fat and a little of the breast tissue. Believe it or not, men have breast tissue as well. And typically, liposuction alone won't break that up enough, so we'll go in and cut that part out.
Hey, thank you, Dr. Dunkley, for coming in. If you want to find out more information about Dr. Dunkley and Envision Cosmetic Surgery, head over to theyoungeryou.tv, and I hope you enjoyed tonight's episode because